very important exam question. It always comes out, even last year.
Hi, Prof. I'm Kavisha here. I'm so sorry my mic wasn't working.
Yeah, buy yourself a new mic.
Yes, sorry.
Okay, so the brain network of language processing, when you read the exam questions, you must be very, very exact. You know, when we ask questions about speech, is something else. Language processing is something else. Brain network is something else, you know. So, and whatever we do, because this is functional neuroanatomy, we always say with the aid of a diagram. If it's an essay or short essay, with the aid of a diagram, with the aid of a figure, discuss the brain network of language processing. You understand? Something like that. Okay? So it may be different this year. I don't know. I'm just saying that this topic is important for you to know about. Okay, so let's go. So everybody of you here have already had an overdose of brain and speech. You would have had it during the trends in cognitive neuroscience and maybe in other topics as well. Okay? And some of you have done some self-learning, you know. Some of you may have a background of speech, and so you say, I'm very bored with this topic. And because we have amongst us, 42 of us, people from diverse backgrounds. You have people with psychology degree, a Bachelor of Arts in English, etc., etc., psychology students, you know, an engineering student, if I'm not mistaken, there's one or two. So I will have to talk differently, you know. Some people say I'm talking like talking to kids, but never mind. We have to teach kids brain anatomy as well. Okay, everybody in this world knows the word dominant, the dominant husband, the dominant wife, you know, the dominant Trump, you know. So now Trump has gone. America is redominating itself. So in the brain, we also have dominancy. But the concept of dominancy is not like what we learned 20 years ago, or 10 years ago, or 5 years ago. We use both brains to talk. Yeah? We use the right brain and the left brain. But there's always a dominant brain. And that brain is usually an hemisphere. The hemisphere consists of the frontal lobe, the parietal lobe. Can you see my cursor? Can you see the cursor moving, or you don't see the cursor?
Yes, Prof.
Okay, that's the parietal lobe. You have the temporal lobe, okay, and the occipital lobe, the small occipital lobe. So everything is involved in language processing. Because when you see, you go out and you see a durian, you know, some people may have seen durians before, and you know, and you want to ask and talk about the durian, you know, the durian king, Musang king, you know, you want to buy this durian by the roadside. You have to use a lot of language processing so that you buy the right durian, the best durian, the cheapest durian. You know, there's a lot of language processing just buying durians. Okay, so if you're right-handed, your dominant hemisphere may be on the left side. If you're left-handed, the dominant hemisphere may be on the left side also. That's why I say that everybody is born differently. That's why we have to test. We neurosurgeons have always got to test people. So in the good old days when there was no imaging, it was the neurologist or the psychologist or the psychiatrist in that period who would examine the patient and determine whether that guy is using his left brain or right brain for language processing. But in 2021, 2020, you know, we have lots of neurotechnology. You can use EEG, you can use the functional MRI, you can use functional near-infrared spectroscopy, you can use many other gadgets to localize language processing. So most components for language processing are located in the left hemisphere. Whether it is a child, not baby of course, we are talking about children above the age of 4 years who have already developed some crude language processing. Most of them are located in the left hemisphere. So the left is the dominant language hemisphere, and everybody knows Broca and Wernicke. I don't think none of you have ever heard of this word. Okay, Broca is one scientist, and Wernicke is another scientist. Not related to each other. Okay, they were all born in different periods. Okay, there is now even in 2020 an anti-Broca, an anti-Broca movement, and an anti-Wernicke movement. You can Google about this because they say Broca described this area wrongly, and Wernicke described this area wrongly according to the latest neurotechnology. But classically, in your cognitive neuroscience textbooks, Broca is Broca, frontal lobe, and Wernicke is Wernicke. Okay? So these are traditional areas. They look very far away on the left side. So the Wernicke area, colored green, comprises of a region that includes many things. Okay, when you're doing exercise 1B, which you haven't started yet, but I've already uploaded to you a few pages where the sulcus and gyrus, the hills and valleys of the brain. Remember, this is the sulcus and gyrus. Do you know which is the hill? Sulcus or gyrus, Anis? Which is the valley and which is the hill? You have sulcus, gyrus. Are you sure? Are you sure you're not upside down? Huh? Anyone else want to try? Sulcus is the hill or the valley?
Sulcus is the valley. The gyra is the hill.
Yes, good. Who's that?
Shubahim.
Okay, so that's correct. So remember, the drain is the sulcus, the valley is the sulcus, the hill, the bump is the gyrus. So there are many sulcus and gyrus here. If you can open the left hemisphere, it will be the size of 2 American football fields. Not your football field yang you main bola, you know. If you open the right side, it will be, and the left side, it will be 4 American football field. So that's why everything is folded, really folded. You know? And what gets folded in the place? Lots of neurons get folded. The white matter tracts get folded, you know. But whatever it is Broca is Broca and Wernicke. So Wernicke comprise of a region that includes the posterior part of the superior temporal gyrus. This, you know, on the top of the brain, if you look, this is the temporal lobe. Okay, you will see one gyrus, superior, middle, second, there's the one in middle here. Okay, you see separated by the sulcus. And then the inferior one right at the bottom here, you can hardly even see it. So 1, 2, 3. So the posterior part of the superior temporal gyrus is part of Wernicke. The parieto-occipital temporal junction, including the angular gyrus. So can you see the angular gyrus? Or is something is this blocking your view?
No, Prof.
It's not. Okay, if it is, then we have to bring it somewhere. Okay, never mind. So the temporal parietal junction is the junction, like a traffic light, between the parietal lobe, the occipital lobe, and the temporal lobe. there is a gyrus there called an angular gyrus because it's like an angle. Like an angle, A-N-G-L-E, so they call it the angular gyrus. Okay? So people can ask you MCQs about Wernicke area. A, the posterior part is part of the inferior temporal gyrus. Of course, you see it's wrong, right? Because it's superior temporal gyrus. Okay? The parietal occipital temporal junction does not include the angular gyrus. It's false. It includes the angular gyrus. So this is how we play around with your multiple choice questions. Okay. So the Wernicke area is concerned with the comprehension of spoken language. So when I ask you, please smile now. And if you cannot comprehend what my instruction is, okay, you will be unable to follow the orders. So there will be a problem with the Wernicke area. So if I tell you, please send assignment 1A by the 15th of November 2020, the last is 12 midnight. Some of you have got problem with your Wernicke area, I don't know for what reason. You send the assignment on the 15th of January 2021. There's something wrong with the Wernicke area. You don't comprehend. Sometimes it's nothing wrong with the Wernicke area, but you just do not want to comprehend. And the angular gyrus, colored yellow here, has to do with comprehension of written language. So if I write a note, I say lift up your right hand. And you're unable to lift up your right hand. So there is something wrong with your angular gyrus. Okay. This information is very important for psychologists, clinical psychologists, and some cognitive neuroscientists. Why? For example, as a neurosurgeon, I do awake craniotomies. That means to say the poor patient is conscious, his skin has been injected by local anesthesia, I have removed his bone, and I'm staring at the brain tumor here. The brain tumor is between the green area and the yellow area. So when I want to remove the brain tumor, I'm trying not to destroy the area of comprehension of written language and comprehension of spoken language. So under the drapes, the surgical drapes, a clinical psychologist or maybe a cognitive neuroscientist will come and then ask the patient to do a few things. And then while I am stimulating the cortex, for example, I stimulate at the angular gyrus, this is where the tumor is, suddenly the patient does not comprehend written language. So I show him on a piece of paper, close your eyes. So our friend cannot close his eyes because after I stimulate this area, I've given electrical stimulation here. This area is paralyzed. Because I see the tumor here. He is unable to close his eyes. So now I say, So written language is here. I have to go in between the sulcus and gyrus very carefully, like playing rugby, okay, New Zealand rugby, and trying to get to the tumor without destroying the green area and the yellow area. So that's how important it is. And the psychologists also do that. The speech therapists also want to do this because if the speech therapist does his assessment, paper and pen assessment, okay, they can also define where the abnormal part of the brain right up to the sulcus and the gyrus if they are very smart. Okay. So the Broca area comprises a region that covers the posterior part of the triangular gyrus, and the opicular gyrus is in the inferior frontal part. So you see that there are now different parts. This is Broca. Okay. So it looks like a triangle because you have three structures there. And there is a gyrus called the opicular gyrus. Again, this is important for three human beings. One is the clinical psychologist or the clinical neuropsychologist, because the clinical neuropsychologist in very developed countries like United States, North America, New Zealand, Australia, China, maybe even Singapore, they are able to read MRIs, the magnetic resonance imaging of the brain. So they're able to they will be looking at the Broca area to see whether there's any abnormality, and they'll be looking at the posterior part of the triangular gyrus to see whether there is any abnormality there. For example, the sulcus may be incomplete. There should be, for example, 3 sulcus, but you find only 2 sulcus. So there is a structural abnormality. The ocular gyrus in the inferior frontal pole is also very important because this is a landmark. This tells, for example, the surgeon or the radiologist who is doing MRI where all these gyrus are and where Broca actually is. But this is structural. Remember, right now, there is no fMRI. These are all brain specimens. Okay? So today, I'm teaching you brain anatomy. When you understand brain anatomy, you will understand the functional magnetic resonance anatomy better, or the MRI better, or the EEG better. Because when you put electroencephalography leads on top of the scalp, if you have a 16 channel, 64 channel, 32 channel, 4 channels, every contact point will be on a gyrus, and some of them may be even sharing a gyrus and a sulcus. So when you do an EEG, for example, and the EEG is abnormal, either it's abnormal due to the problem of cognition, whether there's a brain tumor, whether there's Alzheimer, whether there is a Down syndrome, etc., the structure of the brain are different. You will see the neuronal activity will show different EEG waveforms. So then, even by looking at the EEG, you can infer what is happening onto the speech areas. So, impulse is transmitted from Broca, okay, face to the face, tongue, vocal cord, and area of motor contact for executive speech. So remember, Broca is very important for trying to tell us where you have to communicate with the motor. So when I'm talking to you now, my face is moving all over the place. My tongue may be coming in and out depending in what language I'm talking. Yeah? My vocal cords are trying to shout because I want you to hear me. Okay? And the pharynx areas of the motor cortex is important because I do not want to speak in a Malay dialect or funny dialect that you may not understand my lecture. So this is very important. So Broca is very important. Okay? So Broca is also important in people who want to learn a foreign language. For example, here you are trying to learn Tamil. Like my son, he went to Tamil class. He wanted to learn Tamil. I do not know why. He said it's for business because he's a businessman. And he tried to learn Mandarin recently. And you can find that, the Broca area is so important. So you will find some people who can learn languages very, very easily. And this is because of their Broca. Some of them got very big Broca areas, and some of them got very small Broca areas. So that's all you can see that from the functional MRI.
Professor, may I ask one question?
Yeah, go ahead.
Hi. I wonder, those kids are coming from two different, cultures with the two different languages. Is that easy for them to learn language because they are training Broca's areas, or nothing to do with it?
Yeah. In children, if you can read the literature, it is best for children to learn multiple language from when the brain is 2 years and older. Remember, because you have to learn grammar, noun, and verb. Of course, you can introduce foreign language to a baby, no problems. but the brain starts learning noun, verb, and phenom, and all those funny parts of language from the age of 2 years.
Yeah.
The best is, of course, 2 years, but if you can't afford to send kids to be educated at the age of 2, you can start from 4 years.
Yeah.
And you must remember that the brain, Broca, matures at the age of 27. Most of all, but those studies were done in Caucasian subjects. So remember that the brain matures from the back, occipital lobe, to the front. So vision improves first, mature, memory, and finally, Broca is the last. That's why you can still catch up and learn foreign languages up to the age of 27 or 30. Then you learn it quite well. Okay, so Broca immunity are collected by the arcuate fasciculus. Very, very important highway. When you're driving from Johor Bahru, you want to go to Penang, you use the Plus Highway. And let's say there's a roadblock on the Plus Highway because everybody want to rush out of Selangor, want to rush out from COVID land and go to somewhere else that has less cases. So they take shortcuts. So the shortcuts or the long cuts are all white matter. Remember, we have neurons, and the neurons are attached to axons. So many axons make a track. And when these tracks come together, they are called fascicles. So this is called an arcuate because it looks like an arc, arcuate fasciculus. Remember, most of our terminology are either Latin or Greek. Even the English literature. So a fiber bundle pathway is necessary for repetition of spoken language. So when Broca and Wernicke, there is this fiber bundle pathway. You cannot see it with your naked eye. You can see it if you dissect the brain, of course. You can see it now with modern imaging like, MRI, magnetic resonance imaging. It's called MRI tractography because it's a track, T-R-A-C-T, track. So this arcuate fasciculus, of course, this is a simple red diagram. I think during my talk on brain and speech in trends in cognitive neuroscience, you can see that the arcuate fasciculus is very sophisticated. So this is a simple red line just to show you how they're connected. So if something happens to this fiber bundle pathway here, the guy will have a problem in trying to repeat the spoken language. So why is this important for us to learn? It's not to give us a headache, but if you know this highway exists, there are many things you can do. Number one, if this highway is destroyed by a stroke, this is a very common area to be destroyed by a stroke. So here you are with high blood pressure, lots of cholesterol, you're not eating well, you have, a very bad sleep pattern, your blood pressure goes up and a small clot, cholesterol plaque, and blocks the artery, and this area is destroyed. Partially destroyed. Because you managed to go to the doctor is able to give aspirin or something to dissolve the clot, and maybe 20% of this highway is destroyed. So what happens is we doctors, we do this MRI, we see the arcuate, we know what's happening. So what we do is we do stimulation. We can do direct current stimulation or indirect current stimulation, or we can do ultrasound stimulation, or we can do magnetic stimulation. Because, for example, there may be 2 million neurons here, and of these 2 million neurons, 1 million neuron was destroyed by stroke. So we have 1 million neurons left with their axons. So what we do is we stimulate, it's like bodybuilding, and stimulate the brain cells so that the cells, the 1 million leftover living neuron cells become bigger and bigger, and the axons also become bigger. And then at the same time we do speech rehabilitation, and we see that our friend is able to start to have to gain the repetition of spoken language again. Not perfect, because you're depending on 1 million neurons instead of 2 million neurons, but you're still able to do something. So the cortical areas used in sequence when processing language, okay? For example, if you were reading aloud, you would need to improve your visual cortex located in your occipital lobe. So again, there is your friend here at the back, colored purple, small little guy, occipital lobe. So if you are unable to read, your visual cortex does not function, you'll be having problems also with processing your language, because you're unable to identify the object that you want to say about it. For example, I show you a pen, and you see the pen and say, what is this? What is this? I'm not going to give you a clue. I say, what is this? So if his visual occipital lobe is intact, he may be able to say he has a P there, but he's unable to say N, at the end. So there's something there that is important. So when you do rehabilitation, you don't rehab only Broca and Wernicke. You also rehab the occipital lobe as well. And you have to show things that are familiar to the patient, or familiar to that culture or to that human being, so that he's able to improve on his rehabilitation. Okay, now you want to talk. You want to move your mouth, your tongue, your vocal cords, like I said just now. You need your primary motor cortex. This one colored in orange. Okay, so you see arcuate fasciculus crossing over this bridge, crossing over primary motor cortex. Okay, going to the Wernicke area. So this area, if you stimulate with a gadget, for example, the guy will voluntarily or involuntarily have movement of his face, tongue, vocal cord, and pharynx. So during the operation, for example, if there's a tumor here, if I remove the tumor 100%, our friend may not be able to talk, even though Broca and Wernicke is intact. But because the motor cortex is destroyed by the neurosurgeon, the patient will not be able to use his face, tongue, vocal cord, and pharynx to speak. So then we have to map this area and then come to the tumor via another route, And behind, right at the back, right in the front, light green is a supplementary motor cortex, which is the order to initiate speech. So, when people have stuttering, have you heard the word stuttering? So stuttering can come when you have disease of the supplementary motor cortex. All this I'm showing you is the gray matter. It's the surface of the brain. Okay? Then, the output from the visual cortex goes to the angular gyrus, where it links the image of the written words to language. So you see this yellow line here? I think you see that? Crossing the bridge, going to this, then I start talking to you. I'm looking at the PowerPoint slide now. So on the PowerPoint slide is a diagram. There are words there, there are lines there, and I'm linking the image of the written words to the language that I'm talking to you about. Okay? This network is not from front to back. It is from back to front. You understand? Or are you confused?
Yes, Prof.
The wiring is, the circuit or the network is from the occipital lobe, because I see the pen, I see the horse, I see the tiger, I see the snake, So here it goes. And here I'm talking to you about the snake or the tiger, whatever. Okay? Then to Wernicke, where the words are processed and gives meaning. So this is also important. Okay? So Broca to Wernicke. Without Wernicke, you cannot have any word processing and you do not have the meaning of the words. Then through the arcuate fasciculus to the Broca area, where the vocalization of the words are formulated. So this is the diagram again, showing the same arrows. Then the vocalized program is delivered to the primary motor cortex and initiated to speech by a signal to the supplementary motor cortex. So to have perfect speech, you have to have a good primary motor cortex and a good supplementary motor cortex. So here you are, you want to make a guy sing soprano, but this guy hasn't got a soprano voice. So you may need to stimulate these two areas so that he gets that soprano voice. So these things are the future of cognitive neuroscience. People are not actively doing it now, but this is what we can do for people with brain injuries or people who want to, we call it cosmetic neurosurgery or cosmetic neurosciences, is to make the brain pretty. You have to have a pretty voice, you have to have a strong voice, you have to have a good thinking mathematics, etc., etc. So, in case the speaking words you hear, you will need to involve the auditory cortex. So here, right in front of the green Wernicke is the auditory cortex. Remember, you have the auditory cortex right and left. But everybody says that, oh, there's only one Broca and one Wernicke on the left side. So on the right side, there must be something that represents Broca area, yes. And there must be something on the opposite, on the right side, that represents Wernicke area, yes. And there is the auditory cortex, which is present in both brains, left brain and right brain. So the primary motor cortex to use your face, okay. So that's why your face is located, okay. And the supplementary motor cortex to tell your face to start talking, okay. Same words you hear, and a quick word on language in the right hemisphere. So since we are talking only of left, 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 here we go a bit to the right, and they say that corresponding areas have been measured as metabolic active in the right hemisphere during speech. So this is linked with the melodic function of speech. So melody is mainly on the right side. So for example, when I was in Belgium many years ago, I had to learn to speak Flemish. And when you speak Flemish, it has it's like Bahasa Malaysia. It has its dialect. But in the town of Ghent where I work, we have a Ghent dialect. So I was able, in a period of 2.5 years, I was there for 6 years, to be able to adopt the melodic function of the Ghent Flemish. So that was interesting. So my right brain and my left brain was thinking, talking, understanding everything in one language, which was Dutch or Flemish. And I couldn't speak Bahasa Malaysia anymore. When I returned to Malaysia in 1995, I had a big problem. I could only speak English and I could only speak Flemish. And my Malay was terrible. Okay, before we go to this, which is very, very important, I just want to wait for you to ask questions. Because we got another 15 minutes. So please ask questions.
Prof.
Go ahead. Just tell me who you are so that I know who I'm talking to.
Anissa here.
Shaliza, okay?
Anissa.
Anissa here, okay.
What is wrong with the supplementary motor cortex for people with stuttering problem?
Okay. Why you want to know? Okay, because I want to study stuttering, is it? Okay. You remember, everything on this surface is grey matter. If the brain is not exactly grey. If you open the brain, it looks like this lah. I remember when I was operating this African professor in Belgium, when we opened the brain, all the professors, the white professors came And all the residents came to look at this black man's brain, thinking that his brain was black, you know. So here I was opening up and I was looking and saying, hey, you guys, what are you? You know? Even the white man thinks, even the white doctor thinks, doesn't believe that the African brain is the same color as us. Whether you're Dutch, you're Chinese, you're Indian, you're Melayu, or black, or whatever you want to call yourself, the color of the brain is just like this. So all you see is gray matter, neurons. All these are neurons. Beyond, if you can take this out, you will see the white matter. So the supplementary motor cortex and the primary motor cortex have neurons. Millions of them. The neurons in the supplementary motor cortex and the neuron in the primary motor cortex have different shapes, they're called neurons. Like we say, a Malay from Johor and a Malay from Kelantan, they are both Malays, but they may look a bit different lah. Maybe in Johor, because of the Indonesian influence, they look more like Indonesians. In Kelantan, they look more like Thai or whatever, or maybe Japanese or Chinese because of the influence of the Red China Sea. So you will see that the neurons in supplementary motor cortex are the normal cells may be bigger, compared to the primary motor cortex, which may be smaller, and the number of cells may be lesser. They are always lesser in the supplementary motor cortex. So you need X amount of million of neurons to be able to talk. So due to the deficiency of the shape of the neuron, the abnormality of the axon, or the population of the neuron, okay, you can have abnormality of the supplementary cortex, where you have problem with initiation, and therefore you get stuttering. So you can see this all with imaging. You can do fMRI. You can do a 7 Tesla MRI, which is now coming into Southeast Asia, where you can see that you can even count the neurons. Not with the 3 Tesla, but the 7 Tesla you can. Okay, so this is why or how the supplementary motor cortex is abnormal. You can have stuttering problems. One of the reasons. There are many other reasons, of course. Does that answer your question?
Yeah, Prof. Thank you.
Okay. One more question. Then we have to go to this, because this is exam oriented. I mean, when I give talk, I want to be exam oriented as well.
Prof.
Yo.
Hello, Prof.
Hello, yes. Siapa tu?
Hello. Okay. My name is Shaliza.
Shaliza, okay.
Okay, Prof, I have a question. For those who have learning disability, usually they have a delay in speech. Is that related with the lack of the stimulation of the visual and the hearing part of the brain?
Yes. So as you can see here, okay, all these things. Okay, you see these are arrows. Okay, arrows. Arrows. Okay. Some arrows are in a normal person. The stimulus might be thick, might be big. In normal people, the stimulus might be small. So a small stimulus will give you a inferior result, inferior response. A strong stimulus will give you a better response. So, for example, in patients with stroke, we try to stimulate the brain. So we try to increase the stimuli so that we get a better circuit like this. So you need the whole brain, remember, you need the whole brain to talk. Don't leave today's lecture and saying that, oh, for me to talk, I need only 1, 2, 3, 4, 5. No, you need more than this. You need the whole brain. You need the brainstem. You need the temporal lobe. You need sensory cortex. It's not as simple as I explained to you. Okay? So when you study people with problems in learning, you don't just study 1, 2, 3, 4, 5. You have to study the whole brain.
The whole brain. Okay.
Yeah, the whole brain. Okay?
So that one also same with the those who have echolalia, Prof.
Yes. If you look now
Okay.
in 2020, there is called connectomics. The
Connectomy.
Yeah, connectomy is how one neuron connect to another neuron.
Oh.
So some neurons, they connect differently. Sometimes the neurons are normal. It's like in KL. You stay in a neighborhood. Your neighbors are all normal people. You understand that? But you still can get COVID.
Okay.
Okay, you can also be a neighborhood full of diabetic. Everybody got diabetes. But they don't get COVID. You understand that? Because they take precautions not to get affected by COVID. So the brain is also like that. You have normal neurons, abnormal neurons. You have not only a neuron, you have astrocytes, you have microglial cells, you have oligodendrocytes, you got many cells. So I'm trying to simplify you by just talking about neuron, but there are at least 10 other cells involved in learning, not only neurons. That's why it's
Okay,
impossible
thank you,
for
Prof.
us humans to create a robot just like humans. Because the robot only looks at neurons. They don't look at other cells as well. Okay, so let's go to this important. So the next
Okay.
1,
Okay,
2,
thank you.
3,
Okay, thank you.
4, okay, 5, 6, 7, 8. Okay lah, 7 slides. I want to make it exam oriented lah. Because you know, you listen all of this and say, oh, what am I going to study for my exam? Huh? Okay. So like I said, our exams are always like this. With the aid of a diagram, with the aid of diagram, so a diagram or picture, draw. You have to draw this. That's why that's why I asked you to practice for 1B. Drawing during exam, it's not easy. And 1B is very complicated. The diagram that you have to draw for 1B is very complicated. You will not make it in a 15-minute essay or 15-minute short essay. So you have to draw a simple brain like this. We call it a simple brain with sulcus and gyrus. You have to bring color pencils to your exam room. You know, you have to bring crayons, for example, because you have to draw this. And most of us are not artistic. So some of us draw the brain like drawing a banana or I don't know what, you know. So like a boxing glove or something like that. So you have to draw, and this is the anatomical and cytoarchitecture details of the language. So with the aid of a diagram, discuss language processing. Wow. How are you going to answer that question? Number one, you have to start with the diagram. So this is the diagram that you can copy or draw. This is from Angela Fredici. Angela is, even though you see the paper is 9 years old, but her theory of language processing has not been broken. That means no one else has discovered a better language basis of processing of language than what she has described here. Okay? So we have anatomy and cytoarchitecture. Cytoarchitecture is architecture, I mean to say the infrastructure. So you draw the left brain. Never in your exam draw a right brain. So when you draw the diagram, all of you are right-handed, huh? Are all of you right-handed? Or some of you are left-handed?
Right, Prof.
Okay. The frontal lobe is in front and the occipital lobe is at the back. So your right hand, this is occipital lobe. Your left hand, this is frontal lobe. Then we know that you are talking about the left brain. Okay? So here you are, the frontal lobe, the temporal lobe, the occipital lobe, the parietal lobe, and you draw important areas like the inferior frontal sulcus, the Broca area, which is Brodmann area 44 and 45. In fact, there are more areas involved in Brodmann area. Your seniors who have already graduated, like Joyce and all that, what they did is they read more and they decided to put more numbers here. Because Broca is not only 44 and 45. Broca can go to 47. Broca can go to area 6. You know, if you read certain papers. Okay. So frontal lobe, the premotor cortex, Brahman area 6, and primary motor cortex, Brahman area 4. A lot of your seniors complain. Why do I have to draw both? I say, why do I have to draw the sulcus gyrus? I have to draw the Brahman area as well. I have to name the Brahman area. I said because in the world we have two schools of thoughts. You have the Canadian North American school, they love Brahman areas, okay? And you have European school that love, for example, sulcus and gyrus. So if you're talking two different languages, you combine them to show that you understand. And then you have the parietal lobe. You draw the superior temporal sulcus, the occipital lobe, and you color the hesial gyrus, the primary auditory cortex, better known as PAC, Wernicke area BA 42 and 22. A lot of you during the exams, of course, time is often at hand. So all of you don't have time to write primary auditory cortex. They just write PAC, BA, no problems. We accept that. STS, because writing superior temporal sulcus takes another 3 minutes. So when you're writing, you are labeling according to the areas mentioned here, okay? With your color pencils and calculate and colors, drawing the sulcus and gyrus, you can label this as such, and then you can draw arrows, or you can make little tables like this. Okay, that's the diagram. Okay? Someone say yay for short forms. Okay. Okay, now this is another question, but this is the whole brain. Now this is looking at only the prefrontal cortex. So the prefrontal cortex, as you can see, there are many areas here. And this is studied by Amunds. Amunds is a very famous German professor from Jülich in Germany who looked at receptors. So many receptors. You'll be learning receptors maybe later on. And they will define the receptors because this one is done using radiology. So what Amunds did is she defined this area according to molecular neuroscience, looking at genes. So she broke it up into different parts. So when you are reading into this, the parts of this is Broca, you will find out that Broca, according to Federici, is very simple, and Broca, according to Amunds, is very, very complex. Some of you may love this diagram because you are maybe, I don't know, some of you may be speech therapists or whatever. You want to talk more about brain network, so you want to mention 45A, P and all that. And these are all the different parts of the brain according to architecture and according to the receptors. Remember, they're testing receptors here. So how did they know about the receptor? They took a little part of the brain, they did a genetic profile, and they found receptors. So they colored all this according to receptors. So why are these colors of receptors important? Because when you give drugs, people are trying to find drugs to make our friend who has got a stroke to be able to talk again. So if you know that 45A, for example, 45T, are related to a certain receptor, let's say GABAergic receptor, for example. So there are certain drugs that act on GABA, and these drugs will stimulate the receptor. So let's say 45A has got a stroke. Out of 10 villages, 3 villages have been destroyed by the stroke. There's only 7 villages left. And these are 7 villages which run on GABA receptors. So if you have a drug that can work on GABA, can stimulate GABA receptor, so you can make the 7 villages that are still intact to do the work of 10 villages. So that is how we doctors do things. So this is very detailed. So if you want to mention this, with the aid of diagram, describe language processing. Fine, no problem. You can. I have given you this paper already. Who's your group leader? Is it Shamimi or what? Who's your group leader?
Yes, Shamimi.
Yeah, so Shamimi, I give this paper, I don't know, a week ago, 2 weeks ago, I don't know when you're ready or not. So this is the full paper. You can read this paper slowly and you can discuss amongst yourself. If you're confused, you can always come back and talk to me on WhatsApp of functional neuroanatomy. I can explain further. Okay? So now we're talking about the connectivity. So you've drawn Broca. Now we're back to Angela Fredicci. You're not doing Amunds anymore. Okay? Simple diagram, 45, 44, Wernicke, auditory cortex, and this is the one that I drew red line. Now this has become blue and light blue. So there are many pathways. So with the aid of diagram, discuss language processing. So you have to introduce to me, who will be marking the essay, the dorsal pathway, the first dorsal pathway, the light blue line, the dark blue line. This is PKR, this is Barisan National, dorsal pathway 2, okay? Ventral pathway 1, pinky purple there, okay? Ventral pathway 2. And these are the scheme views of 2 dorsal pathways and 2 ventral pathways that connect the superior temporal gyrus to the premotor cortex via the arcuate fasciculus and the superior longitudinal fasciculus. Dorsal pathway 2 connects the superior temporal gyrus to the Brahman area 44 via the superior longitudinal fasciculus. So they are all these are all highways. So if you are able to draw this diagram, discuss about the dorsal pathways and the ventral pathways, you already have got at least 60% to 70% marks out of 100. And I don't think it's difficult to memorize a diagram. Okay. So what you see, this is all diagrams, okay? But when we do it in the lab, we do fMRIs. So this fMRI, we're able to see the connectivity between, this is Broca and this is Wernicke. So this has lighted up, maybe orangey or reddish on your screen here. And when you're doing something else, this is just for your general knowledge, nothing to do with exam. Brain activation during artificial grammar learning. So when you learn grammar, not artificially, not naturally, like when I'm talking to you, I can teach you face to face. You will see that different areas of the brain will light up, okay? And that includes also the hippocampus, which is part of the temporal lobe, okay? And you can see this is very important in grammar learning because this cannot happen in a 2-year-old or 1-year-old child because the child has to be taught grammar of one language first. So the mother tongue, let's say your mother tongue is Malay, okay? So when you're learning other languages artificially, then you will see that the hippocampus is a very important organ that helps to make you understand other grammars as well. So without the hippocampus, which is part of the temporal lobe, you may have difficulty trying to learn other languages. There are people who cannot learn other languages. So remember auditory language comprehension model. This is a model as proposed by our good friend Angela Fredicci. So she has written here interpretation, the semantic relationship, the thematic relationship, and if you look at this green box here, you have the intonational phrasing. That's why we learn languages. You have to wear that earphone in a speech lab, and then when people are talking to you, you understand, and then you answer the you repeat the question or you pronounce that language or those words. And even when you're taking, I don't know, MUET or IX or whatever, when people are testing your language comprehension, this is what they're trying to look at. Whether you have good language comprehension through the acoustic phonetic processor in your brain, Okay, and then whether you can interpret the messages, and you can measure it using EEG, electroencephalography, and you use what they call as event-related potential, which is the sound. So you can measure the oscillation of the brain waves, and there are certain peaks here like N100, N400, P600. These are electrical hills and valleys going up and down, okay, that you can measure. So the model of auditory sentence comprehension, okay, is complex. You can see that there are different areas for different parts: auditory, syntactic, semantic, prosodic, and the Broca area is there, sitting there, and Wernicke is sitting there, and between these two, there are so many areas that's involved. So for the speech therapist who wants to make a stroke patient talk as he was before the stroke, it is very difficult because most of these areas are not normal anymore. Okay? And you can see the difference between the left brain and the right brain. You see the right brain, the colors? You will see that what is present there, you will see both of the brains have got auditory. Only the left has syntactic. Okay? You see no yellow or whatever lines in the right brain. You see prosodic in the right brain. So you can see that even though there is a so-called Broca-Wernicke interface, the right brain and the left brain is totally different, especially when you have stroke, Alzheimer changes, you can have a bleeding in the brain, you can have degeneration, etc., etc. Okay, so even with sounds, auditory spatial violation, you can change the different areas of the brain, and the different areas of the brain will be normally the temporal cortex, which is the side brain. Remember, that is where a lot of the auditory spatial sounds come in. So you'll be able to appreciate different musics with different tones, intensity. Okay, that's the end of this lecture. Any question before I go to the next one? Any questions? Or totally confused? Or half of you are
Prof? Hello? Hello?
Yes, go ahead.
Prof, I think I quite